I'm Victoria Eley, one of the scientific co-conveners for Brisbane 2024, and I'm here with Professor Weiniger, our international speaker from Israel, who's come all this way to talk to us in the second plenary session of the conference on pushing zero, Carolyn. So what's that all about? Tell us.
So we all want to avoid complications when we're doing obstetric anaesthesia. That's going to be the focus of the talk. So we're going to really look through the hot topics published last year, some of the key ideas that came up in the literature, and we're going to talk not just about what was done and what the findings were, but if we're going to implement these into our practice, are they going to make some changes that are going to get us closer to that goal of having no complications? So one of the examples that we're going to talk about is, should we be avoiding completely a general anaesthetic for cesarean delivery? And is there a price to pay if we reach that metric of zero? Are we going to cause some potential complications by desperately trying to avoid a general anaesthetic because your boss is going to yell at you the next morning for doing one?
Yeah, that's so interesting and really topical, because I think everyone's practicing obstetric anaesthesia in different contexts with different resources. So a fascinating topic. So there's been a few really interesting papers published in the area of obstetric anaesthesia recently. Have some of these things changed the way you're practicing?
So when we read the paper, sometimes we can be thinking, oh, okay, I'm going to try that. So one paper that really stuck out in my mind was published by the group from Stanford, where they did a randomized control trial. It was published in Obstetric and Gynecology just a couple of months ago, looking at calcium. If they administer calcium 1 gram, can that decrease the incidence of postpartum hemorrhage? So although the authors found that in the entire study group it didn't, a pre-planned analysis just of the women with atony, they found that there was a significant decrease in the blood loss. And so we've actually started giving calcium chloride 1 gram to all the patients when the surgeons asked for something extra after we gave the prophylaxis. I can't tell you obviously if this is working because we're not studying it, but it just seems so simple. It's in our drawer, we open the drawer, we give it. That was one practice change.
So, we're using calcium as part of hemorrhage management in lots of non-obstetric situations. So we're also going to be hearing from you later in the conference about obstetric hemorrhage and considering lots of different perspectives. So what are we going to be hearing about in that session?
So I've been asked to talk about the international perspective. It was very interesting when I was tasked with this idea that Israel's part of the European society, and the concept was that some of the viscoelastic machines were developed in Europe, so obviously everybody's using them, right, in order to manage and guide postpartum hemorrhage. It's a topic of postpartum hemorrhage management. Actually, it turns out, as I'm going to share some of the data, there are so many different postpartum hemorrhage management definitions, protocols, guidelines, including the medications administered, and including whether people have viscoelastic testing available to them in the labour ward, in their hospital, and if they do have them available, do they use them? And it turns out that many women are not having their blood management. If they have a postpartum hemorrhage, they're not having their blood management guided by viscoelastic testing. So that's one of the things that we're going to be talking about.
Yeah, so lots of great content coming. Thanks so much for joining us in the conference. I can't wait to hear those presentations.
Thank you so much for inviting. Very excited to be here.